Good morning. Welcome back to Daybreak. It's now 26 minutes to 7 o'clock and it's time to take a look at the reopening of schools. We know that today, like I told you earlier on, grade 4, standard 8 and form 4 learners are back in school. And to speak to us is Dr. Njoki Fernandez, who is a health and safety expert. Good morning. Karibu sana to the show.
Thank you very much.
All right. And she's also a parent, she told me yesterday, of 4 school-going children, isn't it?
Yes, that is true.
All right. And
Yes.
you'll be telling us about that. But before we do so, let's take a look at the state of the coronavirus pandemic in the country by looking at the numbers that we now have, because the total tests have been 591,000 so far conducted, and out of those, 41,546 have tested positive, 31,000, which is 74.6%, have recovered, 1.8% have died, and therefore the active cases are 23.5%. But also what we are seeing from last week's numbers, or the cases that have been reported, there's an increment of 2,119 over the past 7 days. That's a daily average of 302. Very different from what we were witnessing there before, because the previous week, the daily average, I think, was about 187. So you can see it's almost a double. The new deaths that were reported were 35. That's an average of 5 on a daily basis. Then the samples that were tested during that week were 27,715. It's rising again. The number of samples being tested, they had declined to below 20,000, now going back to the high numbers. Then the infections from that, you see that the positivity rate is 7.6%, again rising by the day. So this is how the numbers have been looking over the past several weeks from the 16th week of the pandemic, which is around 29th of June 2020. So the curve has had been going down until week 27, but started going up in week 28, 29. Well, actually between 28 and 29, that's a decline, but now we are back. So it would appear like we are almost near the 23rd week of the pandemic. So we do not know what that is telling us, but I will be asking Dr. What are we seeing, first of all?
So we are observing a worrying trend. Like you're seeing, the numbers are increasing and the curve is quite steep. It's not a gentle slope, it's a very steep slope, which means that the numbers are increasing at an alarming, I would call it an alarming rate. And so people are saying probably we're in our second wave. I don't know how many waves they're supposed to be, but for sure, we're not where we were in a space of safety over the last few weeks.
Okay.
And so it is something that I think everybody needs to really think about and take seriously, because this is a situation for some concern.
Okay. Oh, all right. And of course, this is coming at a time that learners are supposed to return to school. Let's speak to John Wanyama, who is in Eldoret of Uasin Gishu County. Good morning, Wanyama. And you know that learners are supposed to return to school starting today. What are you seeing so far, and what measures are they using to be in a position to maximize on safety?
Good morning, Sam, and I'm at Sosiani Primary School, where learners have already arrived in school, as my cameraman can show you. But now measures that are put in place is that we have seen them taking temperatures at the gate, and they're not allowing in as pupil who doesn't have maybe a mask. And then they have put water all around this compound, just to ensure that whoever walks in here, students, teachers, they can just wash their hands. And maybe if you can talk to the head teacher here. Sir, what is your name, and are you ready for learning? How many pupils do you have for sitting for KCP? Have they all arrived?
Thank you very much, Wanyama. I am Nicholas Kosgei, the head teacher at Sosiani Primary School. In Standard 8 this year, we shall be having 213 candidates. We are yet to know whether all of them have arrived. We have 128 pupils in grade 4. We are yet to still establish whether all of them have come. But the measures that we've put here in school is that we are not allowing any child to enter through the school gate without a face mask. That is one, because the government has not given us face masks. So the parents are supposed to give their children. And then two, we have put water all over. We have enough water, and we believe that as we go along, all our pupils will understand that this is a new normal. They are supposed to wash their hands every time. But there is one problem. There is one problem that we are going to encounter: the bills. We are using Eldowas water. We don't have harvested water. So I don't know what will happen. We wish the government could really give us enough money to pay for these bills.
Okay.
Yes.
Okay, we will talk to you, Mwalimu, some other time in our other subsequent bulletin. But some, as you have heard, they are saying they don't have really enough water, and I wish the government could send the money as early as now. Something else, Sam, is that some few months ago we saw Education CS Magoha coming to this particular region, specifically Rivertex, just to ask them to make masks, especially for those who are students who are going back to school. But it seems nothing has already started, and no even a single mask has been made in Rivertex company, just to ensure that all students who are going back to school will be used. But we are still looking, and we are still doing spot checks around. Sam will get back to you and inform you what is really happening in Western Gishu County. Back to you, Sam.
All right, thank you so much, John Wanyama from Susan Primary School. Of course, you see there, Daktari, that some of the learners are not properly wearing their masks. We'll talk about that, but one Martin Munene is in Nyeri County. Martin, are you at a school, and what are you seeing? Because in Eldoret, some learners are not properly wearing their masks.
All right, a very good morning to you, Sam Gituko. I am at Temple Road Primary School in Nyeri County, that is within Nyeri Town, and I can say something similar to what Wanyama is saying. We have seen several children walking, and I've just seen the last one who just walked in actually had to be told that is not how you wear a mask, and so the teachers have that extra responsibility. And I want to engage briefly the principal of this school to help us understand what they have done, how many learners they have, and what they expect. Karibu sana, this is Citizen TV. Maybe you tell us how many students do you expect to receive today? What measures have you put? And also in terms of these students, how spread out are they in your facility?
Okay. I'm Joseph Kirafi, the principal, Temple Road Primary School. I expect to receive about 82 pupils in class 4 and 83 in class 8. Okay. We have ensured that we are put in place areas where they can wash their hands, they wear masks, and in classes we have ensured that we have put in place the social distancing, 1 meter apart, and each classroom can only occupy about 14 pupils. 14 pupils.
All right. And if I may ask, if you compare the number of classes these two class 8 and classes 4 are occupying right now compared to the other times, how many extra classes are they occupying, and can we be able to see other students in other classes come in?
Right now, the class 8 and class 4 pupils have occupied around 16 classes, 16 classrooms. So the others, I don't see where they can actually be accommodated, not unless we put them in the field. Yeah, or outside.
Okay, all right. He says that the students or the pupils who are here occupying about 16 classes, and we will be going to the classes a bit later to see how they're spaced. But I want to show you something else. If you look on my right here, you'll see quite a number of tanks. These are the places the students or the pupils are coming and washing their hands. But besides that, they're also coming to a desk that is here. I can see a thermogun here. I can see a register here. So once their temperature is taken and recorded, they're also marking to ensure that they actually record the temperature, and they also record the students who are coming or the pupils who are coming. But I am told, as it is right now, all those classes being occupied by class 8 and by class 4 pupils means the others cannot be able to come in. From Nyeri County, I bring it back to in studio. I am Martin Munene.
All right, thank you so much, Martin Munene from Nyeri County. And Dr. You see the two different challenges. One, the learners at Susan Primary School are not properly wearing their masks. If you look at the situation in Nyeri, I don't know whether what hand washing facilities are adequate. I'm not sure I saw any soap or dispenser or even the bar soap. What does this tell us about our preparedness to really go back to school?
Okay, it's a challenge, and I think the challenge is, in my opinion, I feel when the government decided that schools must open, they had a very elaborate document that was circulated to all the schools. A very nice, very well thought out, very well researched document that was supposed to guide the learners in and the teachers in how to reopen. But then now, I don't think there was either time or follow-up to make sure that that document was implemented to the letter. Because, I mean, if all the ideas in that document were implemented properly, we would not be having this situation that we are in right now. So that's a disconnect I'm seeing between a fantastic policy and then now implementation of that in terms of timelines or in terms of even understanding what needs to be done. Yeah.
And I had the school head teacher in Eldoret asking for government support for parents, for learners to have their face masks and so many other things that they're saying they don't have sufficient funds. I mean, how do we do this, knowing that these learners have been in the hands of the parents over the past 7 months? How do you ensure that that safety is shared across all the stakeholders in this?
Okay, so I'll just quickly go through 5 or 6 very quick points and then eventually to see what needs to be done. The first thing is that each school requires documented infection control protocols, including social distancing, masking, and hand washing. Documented, meaning that if anyone goes to the school, they can read what has been written. Each school is supposed to have a COVID-19 rapid response team that is supposed to put this document in place and share this with the parents, the teachers, and everybody, so that even the parent knows what is the requirement in terms of even that mask. So you will not find that situation where the child is coming to school with an inadequate mask or with no mask at all. And then this protocol should be broken down into age-appropriate messages so that that standard 4 child understands in his own little way what they need to do for infection prevention, because these are complex things and standard 4 kids really, unless you really break it down for them, they won't understand. The third thing is that all schools need to purchase appropriate supplies, including disinfectants, soap, sanitizer, masks, thermoguns, and there lies in the challenge, because they are saying that government has not provided adequate financing or adequate support. And my appeal is to the parents, these are your children, these are your kids, and government can only do so much. Government has given policy. So it is up to us to come together as parents in a school and see how we can implement the policy for the sake of our children. So when we wait for government to supply masks, it will not happen. I mean, they can only give so many and desks and things like that. And then another important thing that I think we're going to see this very important, especially in boarding schools, is that the guidelines talk about the provision and management of a school dispensary and sanatorium, including management of home-based care. Allow me to go through this in a minute. When children come to school and they fall sick, I don't know whether you've seen this video that's going around of a child coughing and everyone running away. That is exactly what is going to happen. When kids fall sick in school, there will be a certain state of panic when children get fever. And it's going to happen because, like you've rightly said, we've had these children in our homes for 7 months. We've looked after them, we've protected them, we've not exposed them to the elements. The minute we put them outside there, they're all gonna get sick, which is the natural thing that happens to children. So what is going to happen in schools when they do not have adequate healthcare facilities within the school? Because again, you cannot be taking every child to the public facility. It's not even advisable. So that's important, And then, should there be a COVID outbreak in the school, what is the plan? For boarding schools, they have been advised that they will not be allowed to take the children home. They will have to manage the children within the school. Yes, home-based care, because again, our facilities cannot accommodate all children who are COVID positive. So what are the schools thinking around this? Day schools are okay, we can close them and send the kids home. But what happens to a boarding school? You cannot send 1,000 children home who are potentially exposed, So they need to think about that. And the most important, another thing that is important and is in the guidelines is collaborating with the nearest facility, health facility, for support and management of suspected COVID cases. Once you have a COVID-19 suspected case or a confirmed case in the school, then it becomes a national problem. And the nearest facility has to then take over that care.
Take over that matter.
Are these schools linked with the nearest facility? If not, then that then becomes a challenge. Yes.
Dr. on the screen you see the images, the live images from Star of the Sea Academy in Mombasa. Those are the learners that it appears something like a school assembly. I saw that in the guidelines that were released by the ministry, these are things that should actually not be
yes,
happening.
They actually say no assemblies.
But
You're not supposed to have assemblies.
But maybe because it's the first day of their academic term, if I may call it so, then maybe that's why they are doing the briefing. But so let's focus on, apparently the learner who is in grade 4 or standard 8 or form 4, they have different considerations they have to make, because those that are, the learners that are older would be better in understanding the real situation of the pandemic. But how do you deal with the grade 4 that now they have to go back to school and putting on a mask? Most of them are 9 or 10 years or 11.
Yeah. Okay, the first consideration that is most important is the parent needs to make a decision as to whether the child will go back to school. If your child is unwell, if they have chronic conditions or comorbidities, if they're recovering from acute illness, or if they're undergoing chemotherapy, radiotherapy, or anything that affects their immunity, probably that child should not go back to school, even if they're in standard 8, form 4, or grade 4. That's the first thing, because then you're exposing that child to an unnecessary situation. Then, when the children go to school, these age-appropriate messages are very important, because then they need to understand how to look after them in their own situation. I agree that grade 4s are a bit young. So then you're asking me another question indirectly. What do we do with the kindergarten kids, with the grade 1s to 2s? Because that is where now the situation, I mean, they can't social distance. And I'm just trying to imagine, they've not seen their friends for 6 months. When they meet in school, it will be one big celebration. So the mask then becomes the key to infection control in schools. Right. And I really want to appeal to schools and to parents, please invest in a good quality mask for your children. There's a lot of masks that people are buying outside there, but very few are KEBS approved for school learners, and very few are comfortable so that they can sit with the child the whole day. You see, once it becomes...
So now, what does a parent look out for?
Comfort and safety. Don't just buy because it is cheap and you know you have to give a mask. So let's go out of our way to look, and the schools, I'm really challenging the schools to procure safe masks for your children, because that is the only way you're going to prevent infection control. And the people who are at a greater risk are actually the staff, the teachers, and the non-teaching staff, because they're older. Right. Children can be asymptomatic and they're okay. They're spreading the virus, but they're not sick. But then the staff are the ones who are going to get sick. So you have to protect them. Give them a good mask.
And I'm seeing that at Star of the Sea Academy there in Mombasa, the learners are receiving masks. Never mind that they also are wearing some. So I don't know. Maybe
they've researched and found that is probably a better quality mask. My only problem with those masks is that they're disposable masks. So one of the things you're going to find is that there'll be a lot of litter in the school and drainage blockage, and then those earpieces break off very easily. They're not very good quality. So that might be good for today, probably for the optics. Let's see if that situation, manages by Friday.
All right, very interesting. Of course, we'll be crossing over to speak to Francis Mtalaki in Mombasa. Before we do so, I don't know, how do you see the situation differing between learners that are in boarding facilities and those that are in day schools? I know you said that if in case of an infection, then it becomes easier to manage for the day schools. You can close them. But what must schools do and the learners do, especially those that are in boarding facilities?
Actually, as far as COVID is concerned, I think boarding schools are a bit better than the day schools, because they are able to quarantine, quote unquote, the children within the school and limit contact with the outside world. In day schools, these children are moving in the morning, they're moving in the evening, they're in contact with their parents who are working, they're in contact with the outside environment. So in day schools, the risk is actually higher than in boarding schools. However, in boarding schools, what they need to do is come up with their protocols and maintain them. And the second thing, have a good health system within the school, so that if a child has a cough or a flu, or if they have a fever, you have a system in the school that's able to say, what is this fever? It's malaria, it is UTI, it is a throat infection, and then we treat, so that you don't have to keep going to the health facility for every small ailment. If there is suspected COVID, each school must have an isolation wing. It is in the guidelines. And that isolation isolates the children who you are suspecting could be sick, and then now you take the next step to to investigate and see. Yeah, but this now has to be a school initiative, putting up an isolation wing, and you have to get clinicians, clinical experts to manage that, because it's not the teacher's job. Teachers are meant to teach, not to make a diagnosis of potential COVID, you see.
Right, and Dr. So you raise an important point, but then again, you've been hearing parents say that, yes, you want us to go back to school, we can't afford the school fees. They are saying that the public schools are saying, government, please release more money to us. The government has already said that when it comes to masks, it's up to the parents to get the masks. Yes. So moving forward, how do school communities ensure that your learners are safe, not just because they have a mask, but also those other facilities that you're talking about? How do they exactly do that?
What I'm calling upon the members of the PTAs and the BOMs and the parents to be proactive. I've visited a number of schools where when there is proactivity on the side of the BOM and the PTA, the schools have done amazing things, yeah? Because then they rally the parents and own the problem. For schools where they're waiting for government to help them, actually nothing has been done. And it's very sad because kids are going back to some schools and the preparation is almost zero. And I always challenge the parents, these are your kids. When they fall sick, it will be your problem. When that school closes, I don't think they will ever close the education sector totally. They will close that school or they will quarantine that school. So as parents, let us stretch ourselves a bit further. Let us support the school a bit more so that then we are able to really keep our children safe in school. And remember, COVID is here for the long haul. It's a flu. So it's not going anywhere. I have a very person who's very close to me who is always saying this is a war. And in a war, we do things differently. And we all exert ourselves to make that difference. Right,
and I want us to wind up. But Daktari, we know that according to the statistics from the Ministry of Health, 7% of infections are the only ones that are symptomatic. The rest are asymptomatic. But also we've seen the caseload among the younger generation is pretty low for the children. So what must we expect when this infection begins to spread within the schools?
Okay, two things. Number one, it's asymptomatic. So you will only pick it when you test. Our testing is not so great. So if we're doing 2,000, 3,000, 4,000 tests a day, then that tells you we are not able to test all the learners. In the West, they do massive testing, so they're able to say that there's a spike in a certain school. The other thing is that this disease is asymptomatic, so unless a child has symptoms, you will not know. But then they're spreading the infection. Our biggest bet is prevention. The mask, the hand washing, social distancing, as much as we can, and early detection and management of protection, because in terms of testing and diagnosis, we don't have that capacity. And thanks be to God, it's asymptomatic, but then they spread. And then also, let's look after our teachers. Let's look after our non-teaching staff. Let's look after those who have comorbidities, because that is where now we're going to have a problem. Of course, the COVID cases will increase. That one is guaranteed, but what are we going to do about it?
All right. Thank you so much, Daktari. I wish we had more time to continue engaging on this, but it's just day one, so I'm sure we'll come back and see. We can see maybe in a week or two how we are doing. And I'm sure then we can be able to see what to anticipate when the rest of the children come back. I hear they're also coming back soon. So we'll later hear from the Minister of Health. The Minister of Education. There's something that Professor George Mago has said when we hear of voices from alternative sources. I'll not get into that.
So let's wait and see.
All right, we'll leave with the pictures of Star of the Sea Academy in Mombasa County, where the learners have been attending the morning assembly. They have been given face masks that will appear as the disposable masks. This gathering should actually not be happening according to the protocols from the Ministry of Education. But like I said, maybe it's happening because it's the very first day after coming back to school. That's our time. Dr. Njoki Fernandez, thank you for your time.
Thank you for having me.
Health and safety expert.